First aid. How is something so strong, so fragile at the same time? Horses are big, beautiful creatures, but they are not always designed so well. There are several common first aid emergency situations we encounter, but the following are just a few. So some of the problems that we won't discuss today, we'll certainly try our best to touch base during the case scenarios. So epistaxis is otherwise known as a nosebleed. It may be just a simple nosebleed, but it's really important. It could be something life-threatening. So you want to take note if it's just one nostril, if it's both, if there's been any previous nosebleeds. These are really important questions to have answered. Has there been a history of choking? What is the age of the horse? If it's a cribber. Gutteral pouch infections are definitely life-threatening. It could be the source of bleeding, and they can actually bleed to death from that. They can also be just simple, the horse is reared up, it's cracked its skull, and has resulted in a fracture of its frontal bones. So we don't necessarily get really excited with just a simple nosebleed, but it's important to talk to your veterinarian about it. So epistaxis. On the gray horse, obviously it looks that much more prominent, but again, you want to call the veterinarian, hang a hay net, and keep the horse calm if you do see this, and maybe even bring a buddy into the next stall just to, again, keep the horse as calm as possible. So bleeding from the guttural pouch, and this is the one that I think people need to know that just how serious a simple nosebleed actually could be. The guttural pouch is actually located at the back of the horse's throat. It's a unique structure to the horse. We're actually not absolutely certain why it's there. Some people have postulated that it's because of thermoregulation to help with cooling, but even then I'm not so sure about that. Here we can see at the back of the throat, again, we're using an endoscope to go up the horse's nostril so that we can see the back of the horse's throat. And there's two slits pretty much at the 10 o'clock and 2 o'clock position. And you can see a large blood clot actually extending down from, this is the right side of the horse, so the right guttural pouch. In this particular case, you know it's a bilateral condition. It's affecting both the right side and the left side of the horse. Unfortunately, that does carry a poor prognosis. And if you look further up, so you're saying, you know, are there other things that we can watch for that might indicate this is the problem? Some horses will have choking episodes. So if you do have a horse that is choking repeatedly, don't just think, well, maybe he's just eating quickly. There could be nerve problems, and the nerves that do assist them in swallowing are located in that guttural pouch area. And you can see just in the top here, this is a big food bolus at the back of the throat. So there is some dysphagia. That's what they call difficulty swallowing. Unfortunately, when you have that as well, it does lead to a poor prognosis for the horse. Clostridial infections. Some of you may have seen on social media, there's often the bad Banamine injection saying, please don't give Banamine IM. Has any of you heard of that? Yeah, okay. Have any of you experienced that in your horses? No? So the bad Banamine injection, unfortunately Banamine has a bad rap just because they have such a brand association with it. But so when given IM, so intramuscularly, Banamine can lead, or any other injection essentially in the muscle, can lead to severe life-threatening infection. So there is a label claim for Banamine to be given intramuscularly, but preferably we give it intravenously, and or off-label we give it orally. Just takes longer to take effect if it's given orally. But again, any flunixin megalamine, that's the actual active drug that's found in Banamine, can lead to this as well as any other IM injections. So really the rule of thumb is if I had a horse that I wasn't able to get to, quickly, and it was thrashing around, my client wasn't very comfortable in giving an IV injection, I would probably tell them to give it IM because it will kick in quicker than if they give it orally. Excessive salivation, okay? So there's several different reasons why horses might be drooling or salivating excessively. Slobbers is one of them. Slobbers is a mycotoxin, a fungal mycotoxin. It's usually seen after a wet season, and the source typically is from clover. So if you've got a lot of clover out in your pastures, or you have a lot of clover in your hay, look at the underside of the leaf, and you'll probably see some black spots if this is the reason why they are salivating profusely. Dental issues, foreign bodies in the mouth can also cause this. Foxtail. So the prevention, you want to examine the hay and pasture for the mycotoxin. If you do see it, then move from the contaminated pastures if you have that ability, and change the contaminated hay source if you do locate it in the hay. You want to examine the mouth, remove any irritants if possible. So typically it's going to be a lot easier if the horse is sedated, a full mouth speculum is put in, and you can make use of your vet in order to get rid of any foreign bodies that are there. So this is a video showing the horse slobbering, and this one isn't even as bad as some of them. Sometimes you can get them drooling like this, and all of a sudden there is like a waterfall that comes out. And so it can be quite alarming to the client. But if you do want any more information for any plant toxicities, things like that, OMAFRA has a great website, and you know they have so much more information on plant toxins in horses. There's some great papers on problems with plants and even pastures and that with horses. Okay, so I'd encourage you to use that as a good resource. So foxtail. This is actually in our own barn. So we grow our own hay, but that particular year we decided to buy some hay from another source. And one of the horse had a little, irritation to its gums, and thought, okay, didn't think a whole lot about that, the first time. And then the second day we noticed a little bit more. And so then we thought, well, we better investigate this further, and looked at all the other horses in the barn. And they all had it to varying degrees. So I don't know if you can see this, but right at the gum margin, there's little seeds that are adhered. And if you actually touch the foxtail here, it's quite smooth. So I was really puzzled by how something that feels so smooth could actually cause this type of mechanical irritation to the horse. Anyway, we did figure it out pretty quickly, and we took them off that hay source, and within about 2 to 3 weeks they were completely healed. So, but it is something to watch for. Foreign bodies. So this picture here actually is a horse. It wasn't drooling essentially, but I really thought it was a good point to show. It was an older horse that had started dropping weight, and it has Cushing's as well. So we figured maybe the Cushing's was starting to progress. And dental issues go hand in hand with Cushing, so we wanted to make sure we were checking his teeth. And as horses age, they do get spaces called diastemas between their teeth. We often see dogs with sticks across the roof of their mouth and that. And we see this in some of the horses just because of those spaces. And typically the wood is a source from when you're collecting your hay around the outer edge of the paddocks and there's fallen branches. So if you do get that, I mean, it's inevitable that it'll be in some hay bales. Just try to remove it as best you can. So muscle injury. It's a very common injury, tie-up horses in the racehorse industry. We do see it in some eventing horses as well. In fact, we see it in even pleasure horses, okay? But it's a big one for the racing and the event type horses. If they have the tie-up situation, we often see that they're reluctant to walk, can be extremely painful. The muscles may be firm to the touch, especially over the gluteals, so over the rump area. They might be just rock hard. Sometimes you don't appreciate that if you're dealing with some of the warm bloods out there that might have a heavier fat distribution over there. But you do, if you're suspecting this, you want to make sure you're looking at their urine. Typically, if it's bad enough, then they will have discolored urine. It's usually a port wine colored. They might be labored breathing, so they might be flaring those nostrils, and sweating profusely. So that said, there's different severities. So you can have anything from a poor performance in the racehorse. So, you're not sure if it's sick or if maybe it tied up, but you can have it to the point where it actually prevents permanent muscle damage as well. So if you do see this, it's very important that we use intravenous fluid therapy if certainly the urine is discolored. And NSAIDs, so NSAIDs are your, bute and banamine essentially. They're your non-steroidal anti-inflammatories. You want to give those for pain relief. Sometimes we also use muscle relaxants depending on just the severity of it. But you also want to make sure you hydrate these guys to prevent the kidney damage. That's the biggest factor with this, especially in the more severe cases. Again, if you're not sure, just call the vet and say, this is what's going on. Do you think we need to hydrate with fluids for this particular one? I've seen them urinate. This is what the urine looks like, especially if it's an acute tie-up. Yeah. And we do rehabilitate them differently if it's an acute tie-up versus one where we've got this horse that we know just ties up repeatedly. Right. They are treated differently in that regards. And if you're really interested in it, Dr. Stephanie Valberg out of the US has done incredible research in muscle injury. I get a lot of clients calling up thinking that there is blood in their horse's urine because they've seen it, on the floor and that. And I said, it's fairly uncommon compared to other species. And usually what it's doing is just pulling the pigment out of bedding or something else. And people just see it and they think that that's the case. But it more likely isn't, but it's still something to look into. So muscle injury, you can see here post-op, we're recovering a horse on a very thick mat, and again, that's pretty much to show that we want to protect those muscles from injury, and we try to get the horses up, as soon as realistically possible. But if you do have a horse that has slipped, maybe it's an older horse out on the ice, and it's been down for some time, so it's important that we help with its body temperature, so we can put blankets underneath them, blankets on top, but we do want to encourage that horse to get up sooner than later. Sometimes we need pain medication, so the vet may arrive and give them medications, but the longer they're down for, the more muscle injury that is evident. The other things that you can do to help with this is stretching the lower limbs out and providing a bit of massage as well. Colic, that's the big one. Colic isn't a disease, it's a clinical sign. So it's something that we perceive that the horse is in pain. It's typically abdominal pain, but it can even be from cases of pleural effusion or pleuritis, so something occurring in the chest cavity. So it's very vague. So when we see colic, there can be various signs. You might have inappetence. The horse might be lying down. It might be dull appearing, withdrawn. It might paw. It might look at its belly or kick at its belly. But the big thing here I want is information on the rabies status, or why would we even want to know the rabies status in a horse that's colicking? Colic signs are your most common signs in cases of rabies. And what are we doing when we are examining the horse for colic? We're looking at those gums, and if it's the winter time and our hands are dried, they're cracked, we're looking at the gum color, we're touching the saliva, we're applying a twitch usually, and applying a twitch with gloves isn't it's difficult. We are exposing ourselves when we do treat them for colic and we're passing nasogastric tubes. So we do appreciate that the horses are up to date on their rabies, okay? It's zoonotic, so people can get it. So what do we do if we see our horses colicking? We want to remove the hay. Don't want to add any insult to injury there, right? We want to remove any urine that's in the stall, any manure, and make note of what the manure looked like. So this way we can say that, yes, the horse has passed urine, in the last hour. If there's any new manure production, then we know. We're not just, wondering at that time. So the patient must be able to tolerate restraint. If we're going to help that patient in a colic situation, it has to be able to tolerate either having an intravenous needle for sedation or accepting of a twitch or a lip chain. If you can't do that, please send it for training. So call your veterinarian when you realize that there is a problem. Even if it's just a mild case, it's really nice to have the heads up that we might be called out later in the day. So choke. Choke is very different in the horse compared to people. And people were obviously thinking that we're going to cut our airway off and not going to be able to breathe, so we have to intervene quickly. In the horse's case, it's typically too much feed that's got stuck into the esophagus, okay? So not the trachea or the windpipe, but the esophagus. What you might see is extension of the neck. They might be coughing. They might be panicking a bit and showing some colic signs. You might even see saliva and feed from both nostrils. There might be a history that the horse has just recently fed and has been exhibiting this, or there's been maybe previous choking episodes as well. So it can be awful to watch, but most chokes do correct themselves on their own. Veterinarians needed, though, if the choking does persist. I usually say for anything longer than 1 hour, we need to come out and make sure everything's okay. Sometimes conservative treatment with Banamine or another flunixin megalamine injection and withholding feed is just enough to get them through. So this is a picture showing some saliva coming from both nostrils. This is another point that I really want to drive home, that if you ever do see saliva or feed coming out of both nostrils after a choking incident, it's really important that we treat them prophylactically with antibiotics. I usually put them on sulfa for 2 weeks, okay? So sometimes what happens is the horse may choke, and it may take 7 days for aspiration pneumonia to develop. And if you try treating them at that point in time, often you're behind the 8 ball and it's a poor prognosis. Respiratory distress. This is another common reason why we do go out for our emergencies. So it could be small airway disease. I know someone was talking or mentioned that they have a horse with heaves. It's very common. We all know that normal respiration is approximately 8 to 16 breaths per minute. If we do see any horses that have higher temperatures, or there's nostrils flaring, or there's an increased exertion on expiration, so that abdominal lift that we sometimes see, definitely call the veterinarian. It certainly can be life-threatening. We used to use a product called an Aeromask to deliver inhalant medications. It's no longer on the market. It's probably sold for about $450. There are other devices now. One is called the AeroHippus and approximately sells for $150. But if you do have any signs with your horse showing any of these, then you do definitely want to seek prompt veterinary attention so that bronchodilators and or steroids may be administered. So this is just the device. This is the AeroHippus. And so I guess it's made out of silicone. It's a cup here that just sits over top of one nostril. There's a chamber here where the puffer is released into. So timing is important to make the most out of this situation. This way here, you can supply some steroids to the body without having to have it broken down by the liver and using larger doses. So you're going immediately to the lungs using this device. So respiratory distress, so ways that we can help prevent that would be avoiding leaf blowers, especially if the horses are in the barn. Mucking the stalls and sweeping if the horses are out of the barn is definitely preferable. Avoiding poor quality hay that may be a source of mold spores and other irritants, so you can consider soaking hay if your horse is sensitive. Sometimes hay is stored above the stalls, and in older barns, sometimes that can be a source of ongoing problems. Once the horse is stabilized, if it is running into a breathing situation, then you could consider having a Bronchoalveolar Lavage done. Short for that is your BAL. Some people refer to it as a lung wash. I have a lot of clients that believe when I talk about lung washes that we're actually going to treat the horse. So the lung wash is a treatment, and it's definitely not a treatment. It is a diagnostic procedure, so it gives us more information on what exactly is wrong with the horse. It won't tell us what it's going to be allergic to, but it will definitely tell us, what type of airway disease the horse has and the prognosis. We have the endoscopy tower here. Picture at the back of the throat, the epiglottis. I'm here inserting the endoscope into one of the nostrils. We have a twitch applied. The horse is sedated as well, okay? Usually there's butorphanol added to the sedation to decrease the cough reflex. And then what we do is we put that down into the deepest portion of their lung, and we aspirate back. Once we've passed some sterile saline, we aspirate the solution back and collect that. And that, once it's processed here, there's a pellet that's formed after it's being centrifuged. You can see a little bit of blood in it as well. It's likely a horse, maybe a racehorse that had some bleeding after its race, possibly viruses, but the different cell population will tell us really what is the source of the problem and how we can best treat it in the prognosis.